So I can't expect it to come back next
Okay,
month.
okay.
Just as a courtesy.
Okay, there we go.
You know,
That's a lot of seconds.
Okay, so but at least
volume-
those 5 units, yes, if you can do it, that would be.
Um,
Okay, hold on 1 minute. We check in our connections, okay? Board members, are you able to hear us now?
No, send me the quote, send me the quote.
oh, perfect. Okay, Dr. Calamia. You,
Okay, I'm on now. Thanks. I could hear you.
so, yes or no on the minutes?
That's a yes.
Helen Arteaga Landaverde. Robert Nolan.
Minutes, because I heard nothing before that.
I'm sorry, it was the approval of the minutes. Yes or no?
Jose, I don't know what's wrong. I can't unmute myself, but my vote was yes.
Mr. Nolan, your vote on the minutes, please. Okay, go ahead. You can speak
Okay.
now. I got you.
Okay, Sally Hernandez Piñero. Rita Wang.
Yes.
Benioski Peña Mora.
Yes.
Anita Kawatra.
Yes.
Scott French.
Yes.
Thank you, Juan. Okay, so the minutes have been approved. During the executive session, the board received and approved oral governing body submissions from NYC H&H Woodhull and Metropolitan Hospitals. The board received and approved written submission of the 2019 Performance Improvement Plan and Evaluation from Cumberland and East New York Diagnostic and Treatment Gotham Centers. The board received and approved semi-annual governing body reports, written submissions from NYC Health and Hospitals Lincoln, Coney Island, Seaview, and Gouverneur Skilled Nursing Facilities. According to Article 6, Section C of the bylaws, appointment, the chair of the board shall annually appoint, with the approval of a majority of the board, members of the board to standing committees. I would like to propose a motion to appoint Dr. Dave Shokshi to the Governance, Strategic, and Quality Assurance and Performance Improvement Committees. Any second?
Second.
All in favor say yes.
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 Opposed say no. Okay, so appointment completed. The board convened the 2020 annual public meetings for the boroughs of Manhattan, Brooklyn, and Queens earlier this month. The 2020 annual public meetings for the Bronx will be held on Tuesday, October 13th, and for Staten Island on Tuesday, October 20th at 6 p.m., both at 6 p.m. A determination will be made at a later date as to whether they will be in person or virtual. VENDEC approvals. Since we began the process of approving contracts prior to VENDEX approvals, there are 27 new items on today's agenda requiring approval, of which 18 have VENDEX approval. There is one item from previous board meetings pending Vendex approval. Since we last met, we have received one Vendex approval. We will continue to notify the board as outstanding Vendex approvals are received. Next, we go to the President's report, Dr. Katz.
Good afternoon, everyone. I'm not going to read the report. I want to instead talk about some of the high points. Preparing for possible resurgence of coronavirus is just a horrible idea for all of us. I mean, our staff, our doctors, our nurses, our respiratory therapists, all of our staff are really still traumatized by the events of March and April, and we want to avoid the deaths of so many people as occurred previously. That brings me to the great concern we have right now about an increase in infections that's occurring in 4 neighborhoods in New York City. The Ocean Parkway cluster, which includes Midwood, it's the area I grew up and that my family lived in, Williamsburg, Far Rockaway, and Kew Gardens. And in all those areas, we're seeing seroprevalence markedly higher than the rest of the city, 4%, 5%, and with a lot of concern about how that could spread to other areas. We've been working, David Chusky and I have been on multiple calls with rabbis, along with Ted Long, with Jackie Gray, doing everything we can through Test and Trace, through the Department of Health and Mental Health, to try to change the dynamics before the virus spreads further. We are handing out masks. We have trucks going around with bullhorns giving messages in English and in Yiddish. We are having multiple community meetings with rabbis and other leaders of the community to talk about it. There have been 4 yeshivas that have been closed because of clusters of cases that have occurred there. We will be working very hard over the next several days to try to bring those infection rates down. We're all very aware that in the absence of being able to do that will require more stringent lockdown type measures. We all would like to avoid that. There's no precedent in New York City for going back in terms of restrictions. We haven't even fully opened up yet, let alone to go backward. But we will do whatever is necessary to protect the city. And I hope that the board members are particularly proud of the role that Test and Trace has played. They've had very good success at contacting people, very good success at getting people to isolate by providing them with the necessary support services so that they do not have to go out. They get their meals. We're providing hotel rooms for people. We're getting people their medicines. We are also contacting their contacts. We're doing tracing both in regular communities and in all the schools. We've set up testing sites for everyone. This morning I was at an opening right next to Bellevue at the Alexandria Center, where our Vice President Ken Ford, who's here, has been instrumental in setting up a new lab that is a New York City-based COVID lab, markedly faster turnaround times. Right now, every single test that center has received has gotten a result in 24 hours, and at a price markedly lower, about $35 compared to over $100. Completely New York innovation, New York made. We're going to explode the use of that laboratory because the speed at which you can give people the results has tremendous impact on how well Test and Trace works. Obviously, if people are getting their results 5 days after they've gone for a laboratory, which was not unusual a few months ago, and even more recently, if you went to a non-health and hospital site, then test and trace can't be very effective if people have been in the community already for 5 days. So being able to return labs positive the next day will make a huge difference. And I thank Kenra Ford for all she did to get that lab running, and Ted Long and Jackie Bray for all they're doing to make the Test and Trace Corps such a success. John Olberg, our CFO, has been great about keeping us with sufficient cash on hand. We have $688 million on hand at the end of fiscal year 20. He beat his rather ambitious target. We are watching closely to make sure that we have the kind of finances that really support our efforts. Post-acute, we recognize that Seaview, Gouverneur, Kohler, and Carter all earned Newsweek Top Skilled Nursing Facilities in America. Forget just New York, that's in America, that our 4 facilities are doing so well. Metro Plus is growing. That's by 10%. That's a good thing in the sense that how lucky we are to have Metro Plus. It's not such a good thing in that it reflects the tremendous drop into poverty that's occurred because people have lost their jobs. So sad that the economy has been so hurt by COVID, but good that Metro Plus is there to ensure that just because people lose their job, they shouldn't also lose their health care. We had another very successful year with the ACO, resulting in earned shared savings of $23.7 million. I thank Matt Siegler, as well as Dave, who used to be over the ACO, and recognize their contributions. We're doing flu kickoff early to make sure that we get everybody covered, and we're also collaborating with our partners to get everyone counted for the census. Thank you so much for all of your support.
Thank you, Dr. Katz. Next we have, well, let me ask any board members, do you have any questions on Dr. Katz's report? Okay, thank you so much. Next, we have an informational item from Andy Cohen about an outside legal services contract update.
Thank you so much. I will be quick. On June 20th, 2018, the board approved our agreements with 7 law firms with whom we do a substantial amount of legal business. And at the time that they approved of those agreements, the board asked me to come back in a year to report on both the total spending under those contracts after a year, as well as the diversity of law firm staffing on H&H matters, and that's what I am here to talk about today. I want to be clear, this is the first year of the contract, and the information about diversity is baseline information. We will be communicating with the firms about these results specific to their own firms, and working with them to ensure that they have best practices and approaches that are fully promoting the diversity that we would love to see. Do I have a clicker? Okay. So in terms of the diversity of staffing working on H&H matters among these law firms overall, because we do not have a particular approach typically to measuring the diversity, or methodology for measuring the diversity. We sort of adapted an approach from a mayoral executive order from 1980, but with a few caveats. Using that general approach, you can see that there were, over these 7 law firms, about 90 staff total who were assigned to H&H matters. Overall, about 45% of those staff were women, and about 10% were members of underrepresented minority groups. The issue, one of the issues in sort of tracking things this way is it does not account for how much work they did on our work. This would be everyone who did any work over the period. In addition, these are small numbers compared to the way diversity of staffing is usually tracked under the mayor's executive order. You have to be a company, you have to have at least 150 people per company in order to sort of engage in this kind of a staffing analysis. So I think we can definitely go back and look, now that we have a tracking system, we can go back and think about really what's the best way to show this diversity going forward and make sure we have an appropriate methodology. But this is a baseline, and obviously we can do various cuts at the numbers. We have the numbers. So that's the information on the diversity. With respect to spend, we spent substantially less than the not to exceed amount for the year, which was about a little over $13 million. We actually spent for this group of firms under $5 million. A couple of key points. I want to be clear both on the diversity and the spending. This is a subset, but a major subset of firms that we work with. We do have some specialized firms in kind of more guardianship and mental health law matters and immigration matters and med mal matters. So this is one group of firms. It is a group that we do spend substantial money with, but it's not all of our firms. But the spend reduction, I think, was based primarily on a little bit based on the disruption of COVID. But I think most substantially, we have realigned our staff a bit in the general counsel's office to ensure that we are not sending out to law firms bread and butter work that can be done appropriately by in-house folks and don't require such an extreme level of expertise that we can't do it inside. So that's actually made a tremendous impact on our spending. Overall, we're very pleased with that. I'm happy to take any questions.
Thank you, Andy, and we look forward to learning more about how this information, sort of like how it goes with the companies so they're aware of the data and sort of like that this is a priority for our system.
Absolutely.
Any questions from board members on this item? Dr. Peñamora?
Thank you, Chairperson. Thank you, Andy, for sharing this. This is really wonderful information. I really appreciate you sharing with us this data. I just have a couple of questions. One is that it would be great in another meeting, another time, for you to share a little bit the discussions that you're having with this particular law firm in looking at improving their underrepresented minorities participation in these contracts. I know that you must be having those conversations, but it would be good to have that. The other comment is that I really appreciate the contrast and the kind of complementary nature of the number of people as well as the dollar amount used. And like you're saying, this is a lot less than before, than what you expected, but it may be good to look at what each one of those groups represent of the billing. Like, for example, if we were to look at the women percentage that is close to 46%, you will assume that the expenditure that we had on these lawyers will be like around $2 million if we were to look at, because that may tell us, are we looking at individuals from those demographics at the lower end of the legal profession or at the higher end? That will be something that will be too good to know. Secondly, it will be good to know the performance of each one of the law firms. I know the numbers will be very small, but it will be good to look at the percentage, because when you aggregate it, some of them may be doing very well. Particularly in this case, I know you mentioned that you have one of the firms that is a minority-owned legal firm. So are they carrying the weight for everybody else and others are benefiting from that? I think that would be good to know the differentiation. And lastly is that when you are looking at all that information, it's good to know and maybe you have that answer, maybe you can answer that. When you say the legal services, this percentage of women or minority, are all of them lawyers, or are they some of them paralegal or support staff to the lawyers? That was not clear from your presentation. You may be able to clarify that now.
So actually, that's a great, all of those points are great points. On that last point, the only non-lawyers who really can appear as a line item on a bill from a law firm would be like legal assistants or paralegals. And I would say in our type of work, that's a very, very small portion of the bills. So I would say overwhelmingly, I can't give you an exact number, but I would be surprised if it was, I would assume 95% or more of the spending is on attorneys.
But what about the percentage? What I'm trying to say, I know the spending.
In terms of the numbers of people,
Yes.
again, I think there's a very, and again, I would guess that there are fewer than 5 legal assistants represented in those numbers. That is a rough guess based on our practices, but it's a small number.
Okay, thank you, Andy. Again, thank you for doing this. I really appreciate it. And thank you, Chair.
Yeah. Any other questions from board members? Okay. Thank you, Andy, for the presentation, and let's go through the action items. The first one, Helen, you have the floor.
Helen, are you there? Can you please read the resolution into the record?
Can do it? Yep. Okay, I'll do it, Helen. So the action item number 2 in the agenda, it's approving the designation of Karen Leger, Executive Privacy and Security Compliance Officer, as the New York City Health and Hospitals System Record Management Officer, RMO, as that term is defined under New York State Education Department regulations found at 8 NYCRR 185-1A, to coordinate the development of and oversee the system's records management program in accordance with the requirements set forth under Article 57A of the New York State Arts and Cultural Affairs Law and the implementing regulations thereof. This being presented directly to the board.
Good afternoon, everyone. My name is Catherine Patsos. I'm the Chief Corporate Compliance Officer. A little bit of background on this position. As mentioned in the resolution, the Arts and Cultural Affairs Law requires that government public benefit corporations such as health and hospitals designate a records management officer who's responsible for developing and coordinating the public benefit corporation's records management program. The Arts and Cultural Affairs Law also requires a chief executive officer to designate an RMO to be approved by the board of directors. And the Education Department regulation requires that whenever a vacancy occurs in the RMO position, that a replacement must be designated within 60 days. So the current situation is that on July 6, 2020, Sheetal Sood, who was the former RMO, resigned from the firm. The Office of Corporate Compliance immediately began a search for her replacement, and an offer was accepted by a qualified candidate, Karen Leger, on August 31st, 2020. Because Ms. Leger's start date was not until September 14, on September 3rd, within 60 days of Ms. Sood's resignation, Dr. Katz appointed myself as the interim RMO. Karen's qualifications, she is highly qualified to fulfill this position. She served as the Ethics and Compliance Officer at Fresenius Medical Center, Medical Care North America. In that capacity, she was responsible for collaborating with senior leadership, compliance committee, and board committees on government enforcement trends and identifying risk areas and institutional vulnerabilities. She partnered with leadership to respond to legal and compliance matters involving clinical and operational activities, revenue cycle management, and software systems business. She was also program coordinator for Health First, where she developed a marketing plan for offsite physician offices, budgets for internists, and hospitalist departments, and provided relationship management for internal and external clients, vendors, and stakeholders. She was also the program coordinator for Health First Critical Care Family Assistance Program. She has previous experience as a records management officer at Fresenius Medical Center, where she assisted the RMO there and worked on the record retention policy for Fresenius. Next slide. So given the statutory and regulatory requirement for health and hospitals to have a records management officer, the Office of Corporate Compliance seeks the approval of the Board of Directors to appoint Karen Legere as the permanent records office manager for the system.
Thank you so much. Any questions from board members? Hearing none, then let me, all in favor of approving the resolution? Then yes.
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 All opposed, say the resolution has been approved. Thank you so much.
Is the audio working? I cannot hear.
Can't hear either, Fenny.
Okay, good. I thought it was my case.
I cannot hear the boardroom.
Yeah, no,
Boardroom
it's
is muted, right? Yeah.
Let me read it.
Okay, thank you.
Authorizing New York City Health and Hospitals Corporation, the system, to renew 17 of its information technology IT requirements contracts previously awarded in 2015, listed on Appendix A to this resolution, the contractors, for an 18-month period for health information-related staffing professional services on an as-needed basis to meet the system's needs for professional IT services, primarily for staff augmentation, with all necessary funding deriving from approved program budgets and/or budgets to be approved during the renewal term for a projected amount of $85.8 million. This was approved in the Information Technology Committee meeting on September 10th.
Thank you for the opportunity. I'm Kim Mendez. I'm the Chief Information Officer of New York City Health and Hospital. I am joined today by Apoorva Karia, who is our Corporate Director for IT Fiscal Affairs, as well as Paul Albertson and Keith Talby are also on the line for contract management. As EITS continues to recruit FTEs for our sustainable staffing model and ensure continuity of services and remain flexible to responding timely to new projects, as well as prepare for a possible second surge, we are seeking a renewal of 17 of the 20 requirement contracts for IT supplemental staffing for up to an 18-month period for the term of January 1st, 2021 through June 30th, 2022. The original contract was a 2-year contract with 3 one-year options, and the board in November 2017 approved the renewal of the contracts for that 3-year additional period, and the contract expires on December 31st, 2020. The types of staff that are included are supplemental staff, support staff, and project-based staff for limited time periods. Next slide, please. We are requesting a best interest renewal to assist with the bridging to a more permanent solution and avoid the disruption of having to do 2 parallel processes and switching vendors actually twice. The current set of contracts was competitively solicited and offer good pricing. We've actually had this validated through our new enterprise-wide temporary staffing partner, which is Right Sourcing. And just to remind the board, we actually had approval for Right Sourcing as the vendor-neutral workforce management solution for the system. The vendors have been performing well. They have agreed to keep the pricing flat, as well as beginning in January 2021, IT will begin working with right sourcing the new solution for the system to fold into the IT services with their program. We are extending the agreements will support the continuity of our business and allow us IT sufficient time to phase in the new appropriate titles into the right sourcing program. And additionally, right sourcing is open to additional vendors at any time. The New York City Health and Hospital Market area vendors who would like to work with us will be connected with right sourcing point person, as well as updates from the MWBE certified directory list will be communicated to right sourcing on a periodic basis to ensure we have a current list. Next, thank you. Key benefits of IT supplemental staffing is to ensure that we have the support for flexibility to quickly align with our changing needs, as well as mentioned before, to support with any COVID surge. I wanted to underscore that the payment is based on actual services performed. There is no requirement of minimum payment to the vendors, and the vendors are used on an as-needed basis. Next slide. So some of the enterprise projects that we're currently supporting with supplemental staff include our CRFP, our Capital Restructuring Finance programs. Several of these are the contact center, digital health, which includes programs like our telehealth, population health, which includes our data and analytics and an enterprise data warehouse. Additionally, the modules that we're implementing over the next 18 months under our EPIC EMR, which include behavioral health module, bones, which is an orthopedic module, as well as dialysis. Also supporting the design, build, and testing of both the EPIC and Cerner upgrades, and as well, they have supported us with the T2 testing tracing program. Next slide, please. So I'll have Apoorva provide a review of our contract spend, where we were and where we are going forward.
Thank you, Kim. So this slide gives a historical snapshot of spend against these contracts for the last 3 fiscal years, along with the projection for the next 18 months. We are projecting that we will spend an up to amount of $85.8 million for the 18-month period. For the most part, the historical spend is very much aligned with our project implementation schedules. So for example, FY19, which shows the highest spend, is because most of our sites went live with Epic and had their go lives in fiscal 19. So that year had significant amount of effort. We are projecting that our spend will keep reducing substantially for the next 18-month period. In the next 18 months, most of our spend is aligned with our CRFP program and achieving the goals under CRFP. The requirement contracts that we're presenting are not only used by EITS, but also used by other departments within health and hospitals. Next slide, please. EITS senior leadership evaluates the staffing levels every 6 months to ensure we're appropriately staffed and we are right-sized. For example, during July, when we evaluated the staffing levels, we did discontinue about 59 supplemental contracts, which we project will result in a savings of $9 million for the next 6 months. In addition to headcount, we also look at hourly rates, which have been relatively flat since the contracts were finalized in 2015. In addition, during the July renewals, we were able to make a strategic decision of having all our supplemental staff work remotely. We project a savings of approximately $2.5 million for the next 6 months, and we plan to leverage this model going forward. The next area I would like to discuss is the MWBE. So when these contracts were originally finalized in 2015, there was no MWBE requirement. But during this renewal period, we have been able to engage the vendors with our MWBE program. And as a result, 2 vendors are now MWBE certified, and the rest of them have submitted an MWBE. Given the nature of enterprise projects we have, the skills that we need, and sensitivity around project timelines, but we will continue to evaluate our staffing levels, our staffing needs, and try to strive for a sustainable steady state through different strategies.
You can go to another slide, Dave. The next one, please. Thanks. So New York City Health and Hospital, EITS, is seeking approval to a best interest renewal of 17 requirement contracts for IT supplemental staffing. The term will be for up to 18 months, beginning January 1st, 2021 through June 30th, 2022. With an estimated cost of the contract renewal for $85.8 million. No minimum usage requirement, termination for convenience, and spending under the contracts derives from existing approved budgets, does not require increase or additional funding. And just to underscore, we are transitioning to a steady state. Thank you.
Thank you so much. Any questions from board members? Okay, so hearing none, all in favor of the resolution, say yes.
Yes.
Opposed, say no. Number 4, adopting the attached mission statement, performance measures, and additional information to be submitted on behalf of New York City Health and Hospitals Corporation for fiscal year 2020 to the Office of the State Comptroller's Authority Budget Office, as required by the Public Authorities Reform Act of 2009. The documents are in your packets. Are there any questions about the mission statement and the other documents included there? Okay, hearing none, then all in favor of adopting the mission statement and basically the putting the packet together so that it can be sent to the states. So all in favor, say yes.
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 Opposed, say no. The resolution carries. Thank you so much. Approved. Number 5, Dr. Peña Mora.
Thank you, Mr. Chair. The resolution is authorizing the New York City Health and Hospital Corporation to execute a contract with VA Global Construction Corporation, the contractor, for an amount not to exceed $7,143,946 for construction services necessary for the reconstruction of the exterior facade rehabilitation at New York City Health and Hospital Woodhull Hospital Center, the facility, with an 8.5% project contingency of $712,299 for unexpected changes in scope, yielding a total authorized expenditure of $7,856,245. This was discussed in the Capital Committee on September 10, 2020, and was approved for submission to the board for consideration. Thank you.
Good afternoon. Christine Flaherty, Senior Vice President, Office of Facilities Development. For this resolution, I'm joined virtually by CEO from Woodhull Hospital, Greg Caliste, as well as his COO and Head of Design and Construction, Lisa Scott McKenzie and Ricardo Corrales. This project involves focusing on our main building and conference center, constructed in 1979. The facade of these buildings are currently classified as unsafe by the Department of Buildings. Just, I believe it was this week, the local CAB was concerned specifically about this project going forward and protecting the facade of this architecturally significant building. The brick has a tremendous amount of cracks, and there's a number of issues with the windows and railings, etc. Next slide. In order to comply with the facade safety and inspection program issued by the city and to provide a safe environment for our staff, patient, and the surrounding community, it's required that we embark upon construction of the exterior facade reconstruction with the removal of all of these unsafe conditions that were listed prior. Next. In order to do that, we solicited design firm, pulled together construction documents, and the construction drawings were sent out for public bid. BA Global was the lowest responsible bidder. There were 12 bidders for this solicitation that was public. And BA Global is an MWBE firm and also has a robust subcontractor MWBE utilization plan. So in essence, we have a 100% MWBE team. And what's exciting here is that BA Global has a history working at H&H and in the private sector as a subcontractor. And we're excited to have this be a project for them to work for us as a prime. They did have excellent ratings from private entities that they have a track record working with. Next. This shows you a snapshot quickly of the total project budget. So the architectural design services, construction, and the project contingency is 8.5%. In this case, it's all based around the bid against the engineer's estimate. And so that's our total project budget, which is city capital funding. This is the resolution, and I'm happy to take any questions from members of the board. Thank you.
Thank you.
Could I just ask, is something being done to mitigate these concerns now? I mean, is there scaffold? I mean, is there something being done if there isn't an actual immediate concern?
Yes, the minute that we find out of any concern, we quickly mobilize design teams and put up sidewalk sheds throughout our system. And so sidewalk sheds are in all of the appropriate locations currently. Sometimes for too long as we seek the funding. So we're excited to start the construction work here, which minimizes our expense costs that happen with long-term sidewalk sheds throughout our system.
Thank you.
Christine, can you share with everybody what is the expected completion date for this project?
It is on an earlier slide. I believe it's 2022. Yes. Thank you. It's at 2022.
Thank you.
Any other questions from board members? Okay, hearing none, all in favor of the resolution, say yes.
Yes.
Yes. Yes.
Yes.
Opposed, say no. So the resolution has been approved. Thank you so much.
Thank you. I know Greg will be happy.
Hi, Greg. Okay,
Yes,
so
I
let's
am.
move to the next one.
Yes,
Good to
I
see you. Let's move to the next one. Dr. Peñamora, number 6.
Thank you, Mr. Chair. The resolution is to authorizing the New York City Health and Hospital Corporation to execute a contract with Genco Electrical Contractor Incorporated, the contractor, for an amount not to exceed $5,188,300 for electrical upgrade services necessary for the hospital essential electrical system at New York City Health and Hospital Lincoln, the facility, with a 12% project contingency of $778,245 for unexpected changes in scope, yielding a total authorized expenditure of $5,966,545. This was discussed in the Capital Committee on September 10, 2020, and was approved for submission to the board for further consideration.
Good afternoon. In this case, I have Dr. Khanna from Lincoln on the line virtually, and we're excited to talk about this project as well, looking for a contract into construction. The existing electrical system at Lincoln Hospital is non-compliant with National Fire Protection Association codes, and Type 1 EES is required to be upgraded according to DOH and CMS in order to comply with all life safety requirements. This provides the separation of our emergency power into 3 distribution branches, critical, life safety, and equipment branches, to ensure full operational readiness in all cases. Next slide. This shows you a snapshot of the existing panels in the main electrical switchgear rooms and generators, where the wiring is mixed in different locations, and it could cause disruption to our operations if not addressed. For the emergency department and surgery department throughout the intensive care units. Next slide. This was also a design that was completed and the construction documents were sourced via public bid. Gemco Electrical Contractors, Inc. was the lowest responsible bidders, and there were 4 bids submitted. This was bid out prior to COVID, since COVID has hit, and our more recent bids have demonstrated a much increased uptick in the amount of bidders that have submitted. In this solicitation, Gemco identified a 30% MWBE subcontractor utilization plan. The vendors involved in that utilization plan are listed here. Gemco is an electrical contractor and will be self-performing the other portions of this work. The MWBE amount here is $1.5 million. The project is expected to be completed in 2021. And their evaluations in our system on Gemco's performance has demonstrated excellent, based on as well as good, on a number of evaluations, both by health and hospitals as well as New York City DEP. Next slide. This is the project budget, which shows a $6.3 million total project budget. It shows you the costs for design. Our contingency here is 12%, and the construction bid is $5.1 million. Next. And lastly, this is the resolution seeking approval of the award of this contract.
Thank you so much. Any questions from the board?
I have a question. Christine, the one that we are authorizing right now is $5,966,545, while the total expenditure is $6,301,000. Does that mean that the differences is already have been authorized, or anything has to be amended in this particular resolution?
Sorry, I'm looking between 5 and 6. It may need to be amended. I believe the whereas of the resolution should capture all budget line items.
We cannot hear the board. I don't know if you're talking.
Can you hear me?
We cannot hear the boardroom.
Can you hear me now?
No?
Yes.
Can you hear me now? No?
I can hear you, but it doesn't seem like Fanny can.
You can hear me?
You can
Frida?
hear? Can you hear me,
My
Frida?
problem, because
I can hear you.
it's me.
Hear you.
Yeah.
Yes, we actually hear you.
I can hear you as well.
Yeah.
Fanny?
Okay.
Okay,
Fanny,
Fanny.
you not hearing us? Fanny, you not hearing us?
Can you hear us, Fanny?
Do you wanna?
I don't
You
know.
know what the?
No, I can hear you.
You can
Can you hear me?
Yes, we hear you, Fanny.
Okay, I can hear you. Sorry, Christine, I was not hearing you before. So can you repeat?
So I believe the full budget language is in the resolution. You are correct in that it should demonstrate a 6.1, the total project budget resolution.
6.3. 6.3.
Yes, yes.
Yeah. Okay. So that should be an amendment. I just want to make sure for the board that it should be the 6.3, not the 5.9.
Correct.
Okay. Thank you.
Thank you
Sorry
for
for
that
the
catch.
technology. Okay.
Okay.
Mr. Chair?
Yes, any other questions from board members? Okay, so the idea then is to approve the resolution, but with the amendment that the total project budget is $6,301,000,
Yes,
$682, right?
correct.
And all in favor, say yes.
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 Opposed, say no. So the resolution has been approved. Thank you so much.
Thank you.
Let's move to the next one. Dr. Peñamora, yours.
Thank you, Mr. Chair. The resolution is authorizing the New York City Health and Hospital Corporation to execute a customer installation commitment, CIC, with the New York Power Authority, NYPA, for an amount not to exceed $19,645,521 including a 10% contingency of $1,449,777 for the planning, design, procurement, construction management, and project management services necessary to install new underground storage tanks, the project, and New York City Health and Hospital Lincoln, the facility. This was discussed at the Capital Committee on September 10th of 2020, and it was approved for submission to the board for further consideration. Thank you.
Good afternoon. Once again, we're joined by Dr. Bala from Lincoln Hospital, as well as our head of energy, Cyril Toussaint. I'm going to quickly walk through the project background here. At Lincoln Hospital, we currently have 4 50,000-gallon number 2 fuel oil underground storage tanks in Plant B and 2 10,000-gallon diesel oil underground storage tanks in Plant A. The generators are the main source of emergency power for the facility in the event of a power outage. These facilities' antiquated single-walled underground storage tank are beyond their useful life, and the DEC has inspected and cited this facility for several violations, including the tanks not having the required leak detection system or cathodic protection. The tanks overall require replacement and decommissioning and new tanks. This project will install 2 new 30,000-gallon number 2 fuel oil UST and 1 new 25,000-gallon diesel UST in Plant B. The project will also decommission the existing USTs in place in Plant B and Plant A. The existing 10,000-gallon diesel oil will be removed, and a new 25,000-gallon diesel tank will be installed in the same footprint. This just shows you a brief diagram of the locations. Cyril?
Yes, good afternoon. It does show a brief snapshot of where these tanks are located. Starting with Plant B, the outline that shows with blue is the existing tanks, 4 50,000-gallon fuel oil, plus 1 10,000-gallon diesel tank. Those tanks will be cleaned and decommissioned in place. The area that bordered in red for Plant B, 2 30,000 tanks will be installed. That's fuel oil tanks, and one 25,000 gallon diesel oil tank will be installed in that area bordered in red. For Plant A, the small area that's bordered in blue, 1 10,000 gallon tank will be removed and replaced with 1 25,000 gallon tank.
Thank you, Cyril. In order to implement this project, we utilize New York Power Authority, who has an Encore 2 agreement with Department of Citywide Administrative Services. This Encore agreement serves a number of city agencies and corporations like ours, and it allows us to leverage NYPA's know-how both for construction management, design, and execution of the work. The NYPA agreement, NYPA follows all of the state's rules, which align with our own in that they openly procure as well as have MWBE goals. In this case, Guth de Kunzo is the construction management firm, and they orchestrated a public bid process, which involved 4 bidders to this, and the lowest qualified bidder for the work was Dynamic US. NYPA has an active supplier diversity program and had a 30% MWBE goal. And the next slide. The MWBE subcontractor utilization plan presented by Dynamic is 33.6%, with 3 subcontractors listed. The contract amount in total is $14,154,148, with a $4.7 million MWBE subcontractor utilization plan. This project is expected to be completed December of 2022. Looking at Dynamic US as a bidder within the city rating system, they have a track record doing a number of projects for DEP, a number of tank projects, and had a variety of ratings, both good twice as well as 1 excellent, all submitted by New York City DEP. This is the project budget, which includes all of the elements of the agreement per the Encore agreement with DCAS that we utilize for this project. This is broken out a little more differently due to the structure of that agreement, but it shows you the cost breakdown between design, construction, the payment and performance bonds, which often are in the construction number, the project contingency, construction management costs, project management fees by NYPA, as well as interest during construction, for a total of $19.6. Next. Here is the resolution requesting authorization to proceed on this important project. Any questions?
Any questions from board members? Hearing none, all in favor of the resolution, say yes.
Yeah.
Yes.
Yes.
All opposed, say no. So the resolution passes, carries. Thank you so much.
Thank you.
Next one, Dr. Peñamora.
Thank you, Mr. Chair. The resolution is authorizing the New York City Health and Hospital Corporation, the system, to secure a 5-year revocable license agreement with the Grace Foundation of New York, the licensee, for its continued use and occupancy of 6,900 square feet of space in the isolation building to operate support programs for individuals affected by autism spectrum disorder and their families at the New York City Health and Hospital Seaview Hospital Rehabilitation Center and Home, the facility, with the occupancy fee waived. This was discussed at the Capital Committee on September 10, 2020, and was approved for submission to the board for further consideration.
Good afternoon. In this case, I believe I'm joined for question and answer by Kathy Del Piero and Michael Lanza from the Grace Foundation to take questions at the conclusion of this resolution. The Grace Foundation of New York is a Staten Island-based nonprofit organization formed in 2002 with the goal of improving the lives of individuals affected by autism spectrum disorder. This is a neurological condition impacting many individuals throughout the country. And given the complexity of the disorder, each person presents with symptoms very differently and very individually. This program really focuses on what I would call the gap in care associated with autism spectrum disorder. This is not a nonprofit that's doing IEPs and specific therapeutic provisions that you might see in a school setting. This is a community-based organization that helps individuals from 3 to 30 live their healthiest lives, similar to our own mission. The Grace Foundation has been residing on the Seaview campus for quite some time. This is a foundation that is funded largely by local community members and local businesses that continue to see the critical work that they do every day, helping people and their families with ASD. Next slide. The funding for the Grace Foundation, as already mentioned, really comes from local electeds as well as community organizations. The Grace Foundation does a large amount of collaboration with other local nonprofits and schools, and all organizations looking to support autism awareness. Grace Foundation in 2009 and both 2015, the New York City Health and Hospitals Board of Directors authorized 5-year term license agreement with the Grace Foundation, and that current agreement expires December of this year. The Grace Foundation will continue to occupy 6,900 square feet of space in the isolation building W on the campus at Seaview, at the Seaview campus. The Grace Foundation, since the time of this resolution and introduction to Grace, we've actually started the process of working with Vanderbilt Clinic, and we've identified a number of potential patients that could be referred to Grace Foundation that are pediatric patients that present with ASD. The terms of this occupancy agreement, the fee is waived, and Grace Foundation does provide they're responsible for housekeeping and maintenance of the site, as well as structural repairs of the space. The space itself, if it wasn't occupied by an important foundation like this, would be left fallow and would be a burden on the hospital, the campus, because then we would have to worry about life safety conditions arising formed out of the fact that it was unoccupied and not utilized. This is a map of Seaview's campus, and the Grace Foundation is occupying a portion of the building on the far right. As you can see by this map, it demonstrates that there's 5 vacant buildings throughout the Seaview campus currently, as well as a number of occupied buildings throughout the campus, including a number of similarly license agreements that don't have payment involved and include both fellow city agencies as well as local community groups. So this is the resolution itself. I would say that after meeting with the individuals running Grace Foundation, this is a foundation that I wish was in every borough. They really bridge the gap when it comes to forming communities for family members touched by autism spectrum disorder. Happy to take any questions.
Hi, Vince Calamy. Just a comment to say I'm very familiar with the Grace Foundation and certainly on Staten Island. They have just extraordinary reputation and very broad support. So I'm very glad we can be working with them.
Thank you.
Thank you.
I second Vince. It's rare that you see a nonprofit in existence this long with such just a wide variety of funding sources. It's really a tribute to the commitment of and expertise of their management.
I just want to say that I'm glad we have the space and we're using it this way to collaborate with the community, and happy to see that that's happening.
Yeah, I think that's what I wanted to say too, Jose, Christine. I think you guys, I think we talked about this in Capital Committee, sort of looking at our space and our different leases and how we do more of this. It's a great service we can provide and helps us with our underutilized space. So.
Thank you, Frida.
Okay. All in favor of the resolution, say yes.
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 Opposed, say no. So the resolution carries. Passes. Thank you so much.
Mr. Chair, I will recuse myself for the remaining of this meeting.
I will also be recusing myself for this resolution.
Thank you. Thank you, and I will see you. We'll see you later, Dr. Peñamora. Let me move to the next one. Number 9. Authorizing the New York City Health and Hospitals Corporation to negotiate and execute requirements contracts with 7 architectural and engineering consultant firms, namely Architectural Preservation Studio, DCP, H2M Architects and Engineers, Hoffman Architect Inc., Lothrop Associates LLP Architects, Ronette Riley Architect, Superstructures Engineering and Architecture, Urban Architects DPC, to provide professional AE design services related to exterior envelope projects on an as-needed basis at various facilities throughout the corporation. The contract shall be for a term of 3 years with 2 one-year options for renewal, solely exercisable by NYC Health and Hospitals for a cumulative amount not to exceed $10 million for services provided by all such consultants. This was approved at the Capital Committee, September 10th, 2020.
Thank you. My name is Oscar Gonzalez, Assistant Vice President of Office Facilities and Development. Also on the phone should be Mandrana Indar, Senior Director for OFD. Just a quick overview for the request to enter into contract with these A&E firms. These are firms that will provide professional services both for architectural, engineering, design, and construction related on an as-needed basis for projects throughout our system. Services include facade projects, also known as the skin of the buildings, roofing and related work, window assembly, and local law 11 compliance. The current contracts that we have in place for similar services will expire December 2020. The current spend for the facade services is just under 6.3 million to date. Next slide. The DOB has asked health and hospitals to develop a systematic plan to address the historical local law 11 violations and to schedule the cycle 7 and 8 required inspections. Superstructures, one of our consultants, had an existing database of health and hospital buildings and met with DOB on behalf of H&H to help update the local law 11 universe. So they helped update the building addresses, dismissed H violations, and addressed current violations. Of the nearly 6.3 million spent to date, there were just over $6 million in approved work orders assigned to superstructures alone to file, investigate, and do corrective infrastructure work to all of our facilities. With the help of superstructures and our teams, being led by Elizabeth Youngbar, who did a very wonderful job, we reduced our outstanding violations from 250 violations to 110. The RFP criteria, the minimum criteria required that all vendors provided a MWB utilization plan, have minimum 5 years of satisfactory compatible services in healthcare facilities, and have licensed professionals that hold the New York State license in this discipline. The evaluation criteria required 25% of approach and methodology, 25% of firm experience, 25% of staffing experience, 15% of MWBE participation, and 10% for the cost. The evaluation committee consisted of 2 representatives from the central office, OFD, 1 representative from Metropolitan, 1 from King's, 1 from Jacoby, and a representative from our IT department. So quick overview on the procurement. On October 15th, CRC approved an application to issue the solicitation. On January 9th, the RFP was sent directly to vendors and posted on City Record. On January 16th, there was a mandatory pre-proposal conference where 33 vendors attended. The proposal was due on January 31st, and we received 21 proposals, all of which had robust MWBE utilization plans. On March 12th, the evaluation committee got together and we scored all the proposals, and based on the natural break of 12 vendors, were invited back to present to the committee. 2 of those vendors were MWBE. On July 13th, just a quick short break during COVID, the evaluations were submitted for the scoring of the presentations. As a result, we're seeking to enter into contract for these A&E firms, specifically for exterior envelope. This is the list of the firms: Architectural Preservation Studios, also known as APS. This is one of the MWBE firms. H2M, Hoffman Architects, Lothrop Architects, Urban Architects, Renette Riley, also a MWBE firm, and Superstructures. All have good ratings with different works that they've done throughout the city. This is a list of some of the projects that they've worked on, both with Health and Hospital and with other city agencies. We're seeking to enter into a 3-year with 1-year option to renew, effective no later than this coming January 1st, 2021. Total pool contract value is $10 million. And as previously mentioned, they have a robust 30% MWB plan, which was submitted by all the vendors. Next 2 slides will show you the all the subcontractors that were going to be utilized, which adds up to a total of 52 sub-consultants. And with that, it's just the request to enter into approval. This is the resolution.
Thank you. Any questions from board members?
I have a question from Helen Artiega. She would like to know, will these firms help with the balance of the violations?
Yes, absolutely. They will work closely with DOB, with us, and with our teams to reduce all the violations down to 0.
Thank you. Any other questions? Okay, hearing none, I would like to have a vote. All in favor say yes.
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 Opposed say no. Resolution carries. Thank you so much. The next one, it's number 10. Authorizing the New York City Health and Hospitals Corporation to execute a contract with Turner Construction for an amount not to exceed $5,095,551 for construction services necessary for the emergency department reconfiguration, aka the build out of the new Express Care at NYC Health and Hospitals Harlem Hospital Center, with other contracts associated with this project totaling $1,882,022, including architectural and engineering services, and a 28% project contingency of $2,659,000, $659,176 for unexpected changes in scope, yielding a total authorized expenditure of $9,636,750. This was approved in the Capital Committee September 10th.
Good afternoon. I'm joined, I believe, via phone with Ebony Carrington, our CEO of Harlem Hospital. Ebony, are you there?
Here.
Okay. And so we're going to start with the project background of the need at Harlem Hospital for this project, and I'll let Ms. Carrington speak to the project background.
So this is the need for us to construct an urgent care or an express care in our old emergency department. What is different about this and why we are very excited about it is because we have a significant amount, or greater than 50% of the patients that come into our emergency department that have a low acuity, or an ESI of 4 and 5, basically equivalent to an ambulatory care type patient. And so we find that although we do have strong access, that there is just an aversion in some cases to utilizing our ambulatory care service. So we found this to be an appropriate hybrid that we know could ease the congestion in our emergency department, the recidivism, and we also plan to integrate patient education as a huge component of our discharge planning from Express Care. So I'll pause there because I can talk about the benefits of having the space constructed and how we think this will improve our outcomes. But if there are any more direct questions, I'm glad to entertain those programmatically.
Makes sense.
Okay, so Christine, I think the project background is clear, and this is one of those things that we are very excited to construct because we believe it'll add value in many different ways.
Thanks so much, Ebony. This project is being funded by DISRIP, so that was quickly on the end of slide 3. And this project, the design was completed. Next slide. And the construction documents were sourced via public bid after the surge of COVID. I'm pointing that out because now we have 17 bids that came in when normally we used to have 2 to 4. Our low bidder in this case was Turner Construction. They presented an MWBE plan of 42.1%. The contract amount here is $5 million and change. The MWBE spend amount here is over $2 million. The projected completion is in 2021, and there's evaluations that were pulled from MOX that include excellent and good by multiple evaluations at New York City Department of Design and Construction. So here's the project budget. As it was mentioned, there were 17 bidders here on a project, and the engineer's estimate was substantially higher than the bids that came in. The market, we are seeing this trend across the board on our public bids. And so here we have a higher project contingency because the construction bid is a lower bid than planned. So this shows you the total project budget of over $9 million. And finally, the resolution is here that clearly articulates the authorization request to commence this project with this vendor for a total authorization expenditure of $9.6 million. Any questions?
questions from board members? The only comment that I have on this is that this sounds like a great idea, and I'm glad that we are doing it. Anything connected to express care, it's a plus for us. So, okay, so let's have a vote. Everybody in favor, say yes.
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 Opposed, say no. So the resolution passes. Thank you so much.
Great. Thank you so much.
And Ebone, great to hear your voice. And
Thank
thank you for
you.
everything
Thank you
you
so
do.
much for the vote. Thank you.
Thank you. Okay, so we have one more resolution, and it's appointing Sharif Sakar as a member of the board of directors of MetroPlus Health Plan Inc., a public benefit corporation formed pursuant to section 738520 of the Unconsolidated Laws of New York, to serve in such capacity until his successor has been duly elected and qualified, or as otherwise provided in the bylaws of MetroPlus. And this was, his nomination was put forth and approved by the MetroPlus Board of Directors September 14th, 2020. I don't know if, Sally, do you want to say anything on this appointment?
Just that we're extremely excited and we appreciate everyone's support at H&H because we had to go through some challenges getting this done. Sharif is a partner in Deloitte's U.S. member firm. He's the chief operating officer of Deloitte and Touche LLP. He has both national and international responsibilities. And we're very excited that he's going to be joining MetroPlus's board.
Thank you, Sally. And I had a chance also to speak with him. Very competent, very capable person. So I'm his background in accounting, his experience, and overall, his what I found most interesting is his enthusiasm of serving on the board of MetroPlus. Caught my eye there. So I'm glad that he's interested in helping us. So I would like to have a vote then. All in favor, say yes.
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 Opposed, say
Yes.
no. Okay, so the resolution 11 is approved. Are there any, let's see, due to the virtual meeting setting, the committee and subsidiary reports were emailed to you for submission into the record. Are there any questions or comments on those reports? Okay, hearing none. Any old business? New business? Thank you so much. Meeting is adjourned.
Thank you.
Thank you.
Thank you. Thank you.
Well done, Jose. Keep the 4:30 clock.